Here we are at Park Avenue LASEK, New York's only 100% non-cutting laser vision center, where we specialize in LASEK, which Dr. CHYNN helped invent when he was at Harvard. So we have a very special guest here today, Dr. CHYNN's close personal friend, Shobha.
Started out as a patient.
Started out as a patient. Very complicated history. A bad LASIK originally came from cutting the flap, so because we've eliminated that stage, not only can we not have a flap complication, but it also means we can help fix prior not great initial LASIK surgeries. So I want to hand over to Dr. CHYNN first, just so he can explain a little bit about Shobha's backstory and where she's at right now.
Yeah, well, Shobha knows so much, and she's so smart and did so much research. She can do the story as well as I can. So you want to just explain a little bit about your history?
Yeah. So I got the flap surgery done early in 2002. It was a correction surgery. The previous surgery was done in '99, and
that was
enhancement was done in like 2002 February. And all of a sudden,
you had both eyes enhanced.
both eyes were enhanced. And can I give the doctor's name?
Let's just say initials, but he's not a great doctor.
He's not a good doctor. He's not practicing in the tri-state anymore.
His license removed.
Yeah, his license was removed on similar cases like mine. But I couldn't see, and he was the first doctor. It was a long weekend, and I called him in distress, like crying because I was bedridden, and I couldn't see. So Dr. CHYNN operated on me the same day, right? So, and it was he stayed just to give me some relief that I get out of pain a little. And we were listed for cornea implant and all.
Oh, right, you were supposed to get a corneal transplant.
Yes,
Yeah,
and it was really bad case, and thankfully for his thinking outside box and our researching together, we came up with a solution. And I see today clearly is because of him. If it was not him and not his thought process, and I would still be not seeing, or maybe having complications of transplant or something.
We did like an experimental thing. She had a bad complication from epithelial ingrowth after the flap enhancement. So if you lift up the flap and it doesn't go that cleanly, the skin on top of your eye, instead of growing on top of the flap, goes under the flap. If too much goes there, it releases enzymes and it melts your flap. So when she came to me, she had a pretty bad flap melt in the left, and I think in both eyes, yeah. And then I think the previous doctor kept on trying to fix it, or anyway, couldn't get the epithelium out. So there was an experimental procedure back then to bring her to the hospital and like YAG laser her. Mm-hmm. So it's a special laser we did. I brought her down there, and at the time, I think really only a few cases had been done in the United States. But it worked great. It really worked like a charm. I think we did write it up and publish it somewhere.
You sent it to Howard.
Yeah, I think we published. Yeah.
And then people learned so much from it, because it's also called Sands of Sahara.
Yeah.
People have not seen it. So there were so many doctors who came to your office to see like this actual eye, because people have never seen it. It's just written in the books that it happens. But in my case, like they were able to study.
Yeah, you got unlucky because you had a couple of bad complications. You also didn't have a great surgeon who didn't see you post-op very well. So so we fixed that Sands of the Sahara, which is also DLK. It's a bad inflammation. I think that I just saw today we sutured that flap, and then also did the YAG laser. But now, after 14 years, you're actually legal to drive day or night, so it's good.
Yes, I'm like so excited today. He gave me the news. I can drive and in daytime and without glasses, and I'm so elated. I can't get back to
and then just with a light pair of glasses, you'll be legal to drive at night, and you can drive your kid around, Abigail, and you won't have to be so dependent on Gary, because her husband's really loyal, but doesn't want to play chauffeur all the time.
And I can't be more happier, and I can't say much more gratitude for Dr. CHYNN. I see today is because of him, and of course the prayers.
And then down the road, we can enhance your left eye, so you won't need glasses. We can always, anybody with a screwed up flap, we could do a LASIK on top. You don't have to guess how you're going to see. We could do a preview lens and shoot the lens as the eye. It's plastic. You hold it up, and that's how you would see. So down the road we'll do.
We'll do another video.
So down the road we'll do a preview lens and get rid of it for real. But anyway, the lesson is the non-cutting thing is much safer. If you have a flap complication, we can help you. And people don't see well after LASIK, they shouldn't give up. They should come in. We could do a preview lens and show them how much better they could see afterwards.
And also, lesson is the doctors should have integrity, and patients benefit more than their financial.
Yeah, look, one of the reasons why a lot of doctors don't do the non-cutting is it takes a lot longer in the post-op, and those visits are unreimbursed. So you can make more money doing LASIK. I stopped doing LASIK just because it's not a bad procedure. I had it myself. Many more complications, and I'm willing to be seeing the patient a couple more times, and they're willing to come in to avoid all the complications.
Yeah.
Okay.
So thank you so much.
Thank
Love
you.
Love you.
Okay, so if you have any additional questions, please give us a call, 212-741-8628. Alternatively, you can check out our website, www.parkavenuelasek.com. That's Park as in Park, Avenue as in Avenue spelled out, LASEK, LASEK.com. Main takeaway is, please don't get a flap cut, but if you're unfortunate to have it done already, then we can help out. Okay, so thanks a lot.